All right, so we will go ahead and get started. So welcome everybody to the MeMD webinar presentation on COVID-19. Thank you, and we wanted to say thank you to everybody for attending today and welcome. And before we get started, I just wanted to do some quick introductions so you know who is presenting today. So my name is Dana Lurch. I am the Clinical Operations Manager here at MeMD. Also on the call, we have Jessica Taylor, who is MeMD's Vice President of Operations, and Dr. Nicholas Lorenzo, who is our Chief Medical Officer. So you'll be hearing from them today as well. Now, everybody that is attending the presentation today, you are all muted, but if you have any questions, there is a Zoom Q&A bar. So use that Q&A button in your Zoom bar if you have any questions throughout the presentation. Okay, so today's agenda for the presentation is I'm going to review the who's involved in MeMD's coronavirus rapid response team. Then I'll hand it over to Dr. Lorenzo to discuss what is COVID-19 and who is at risk. We'll cover the telemedicine advantage in screening and testing. And then Jessica will come in and discuss the resources and communications we have sent out and also some interim guidance. Okay, so MeMD's coronavirus rapid response team includes Dr. John Schufelt, who is MeMD's founder and chairman, Dr. Nicholas Lorenzo, our chief medical officer, myself, and then also Kat Smith, our director of communications. And with that, I'm going to hand it over to Dr. Lorenzo.
Well, thank you very much, Dana, and welcome to everybody on the webinar, and thank you for giving us a little bit of time today to review the COVID-19 coronavirus situation, both for MeMD and nationally. And hopefully you'll find the information that we present today useful and in some ways comforting. And so what I would like to review with you just at the top here is that COVID-19 is a new mutated RNA virus in the coronavirus class. So what does that mean? What's the coronavirus class? The coronavirus class is a group of viruses that typically cause the common cold. And it might surprise many of you that about 1/3 of the cases of the common cold in the world are caused by this class of virus. Now, why then are we worried about COVID-19? If it's a coronavirus and coronaviruses just cause the common cold, why even be worried? Well, this is a newly mutated RNA virus. So we don't have any pre-existing immunity to this version of the coronavirus. If you do the math real quickly, all of us on this webinar probably get 1 to 2 colds per year. It's just a way of life, right? Especially in the winter and spring months. And so if you do the math, and let's say you're 50 years old, and you do the math, if 1/3 of your colds are caused by coronaviruses, you probably had a type of coronavirus in your life anywhere from 10 to 15 times. And that means that you've built up some immunity to those existing coronaviruses so that when you get a cold, it's probably not going to be as long as the cold you got when you were in your pediatric years or in your teens or 20s. Now, the problem is, however, that COVID-19 is a new mutation. So that pre-existing immunity is not going to help with regard to the clinical course of this particular virus. So it's going to be longer, a little bit more severe. So instead of your typical 2 to 3 day cold, you might have a 5 or 6 day cold. And so who is at risk for encountering COVID-19? Well, the CDC has been tracking this very closely, as has the World Health Organization. And on your screen there, you see a link to the latest information on where the COVID-19 virus is most active. And you can go to that link, and it's updated frequently. And so countries are added to that page as necessary. But the countries there right now are ones that you're probably familiar with, having watched the news. And that would include China, Iran, Italy, and South Korea. But really, anybody traveling overseas, especially from Europe, is at higher risk of being in contact with COVID-19. So if you travel to any of these hotspot areas in the last 2 weeks, and now you have upper respiratory infection symptoms, you are at higher risk of COVID-19. Or if you've been in contact with a friend or family member who has recently traveled to one of these high-risk areas, who now has symptoms, and maybe you have symptoms now, you are at higher risk of COVID-19. And the final group that has a higher risk of COVID-19 are any healthcare providers or family members who are helping to treat or manage patients with known, I'll repeat that again, known laboratory-proven COVID-19. So if you're a nurse in the hospital, for example, and you've been treating known COVID-19 patients who've been laboratory test proven, and then now you have upper respiratory infection symptoms, obviously you're at higher risk of COVID-19, and the CDC has identified you as being in a high-risk group. Now, one more point as well, because COVID-19 is a coronavirus, and coronaviruses cause about 1/3 of the cases of the common cold, it's not surprising then, if you get COVID-19, that what are you going to experience? A runny nose, low-grade fever, sore throat, and a cough. Oh my gosh, that sounds like a cold. And it's no big surprise because, again, COVID-19 is a coronavirus. The other coronaviruses commonly cause the common cold. Next slide, please. So the patients that we want to really focus on with COVID-19, or potentially COVID-19, are the higher risk patients. Again, because none of us have pre-existing immunity to COVID-19, it's going to be older patients, that is patients over 70, and or patients with chronic medical conditions, such as heart disease, lung disease, kidney disease, diabetes, immunosuppressive disease, cancer patients. Those kind of patients have a higher risk of complications from COVID-19, complications that might include pneumonia, sepsis, and in a small number of cases, even death. So to make a long story short, if you're not in one of these two groups, even if you get COVID-19, the vast majority of patients who are not in high-risk group are probably going to get a mild to moderate cold, which may last a few more days than your average run-of-the-mill cold, but in fact, it's going to be a cold or upper respiratory infection. On the right there, you see in the blue some of the precautions that people should be taking, and you've probably heard all about these on the news over the last week or so. And in other words, to stockpile on needed supplies, including medications, use good public health habits such as washing your hands, don't touch your face, cover your mouth and nose if you sneeze or cough, especially if you're around other people. And also try to stay away from other people and crowds as well, where coronavirus can be passed more easily, is also important. And for higher risk groups, especially the ones I mentioned, older patients and or those with chronic medical disease, avoiding travel, if at all possible. So on airplanes, cruise ships, etc., that's an obvious one as well. And if you're sick, whether you have COVID-19 or not, staying at home and using good public health precautions, which I will be going over in more detail in a few slides. Next slide, please. The CDC and the Department of Health and Human Services, since the beginning of this crisis, about 10 days ago, has identified telemedicine as a key part to the evaluation and treatment and follow-up of the COVID-19 coronavirus situation. And the reason this is important is that it is possible for the vast, vast majority of patients, even if they have COVID-19, to be evaluated and treated and to recuperate at home. There are obvious advantages to this: the comfort of the patient, the safety of the people taking care of them, especially if the other option would be to go to a live in-person clinic, such as an ED or an urgent care or a primary care office, where you potentially are going to expose the healthcare workers and others perhaps in the waiting room to a potential COVID-19 infection. And so there are lots of advantages to telemedicine. And in fact, like I say, the CDC and the Department of HHS have pointed to telemedicine as a key part of the COVID-19 national rapid response. Next slide, please. So there are a lot of questions out there as to how to manage these patients. And the entire administrative team and leadership team of MeMD has kept up with the recommendations of the CDC, Department of HHS, as well as the local and state health departments. So what I'm telling you here is the up-to-the-minute recommendations of these very important and alerted agencies. Let me take just a moment here to give you some hope here. The president is going to have a news conference in about an hour to declare the COVID-19 situation a national emergency. And I think that's very appropriate because it frees up federal dollars and FEMA and other agencies to be able to help managing the COVID-19 situation. But the director of the National Institute of Allergic and Infectious Diseases at the NIH, Dr. Anthony Fauci, this morning had a Q&A session. And Dr. Fauci is a recognized national and world expert in infectious disease, specifically COVID-19. He is privy to all of the data, both internationally and in the US, pertaining to COVID-19. And he predicts that there is light at the end of this tunnel. His estimation is that this crisis will begin to slow down and decrease in about 4 to 5 weeks, give or take 1 or 2 weeks on either side. So he is saying that our aggressive response at this point, which we're doing, is the appropriate way to control and treat these patients, and that there is light at the end of the tunnel. So all of us need to take a deep breath, do our jobs, and get this done. And let me segue real quickly into complimenting our MeMD leadership and administrative team and our provider network, who have been so cooperative and have been doing 24/7 work to keep up with this crisis. And I am certain that MeMD is as ready, if not more ready, than pretty much any healthcare organization out there, whether they be telemedicine or not, to deal with the COVID-19 situation. So back to the symptoms of COVID-19 infection. To make a long story short, it looks like a cold, maybe a mild influenza. And so the vast majority of these patients, because it is cold and flu season, are being treated and can be treated and evaluated at home. If they do not have a risk factor for COVID-19 that I outlined earlier, that the CDC outlines, that is exposure to someone who's traveled, or they have traveled themselves, or known exposure to a COVID-19 patient in the hospital, for example, then these patients, according to the CDC and local and state health departments, do not need to be tested right away. Their chance of having COVID-19 is very, very low, and they don't want state and local health department laboratories to be flooded by patients who have a small percentage chance of having COVID-19. So these patients can be managed at home, those with no risk factors for COVID-19 exposure. But if we do run across a patient that has a risk factor for COVID-19, for example, let's say there's someone who just got home from a trip to Italy and now 3 days later has upper respiratory infection symptoms, then MeMD has in place a system to evaluate these patients and to help them get tested at an approved testing facility if they do not need to be sent to live in-person care right away. The vast majority of patients can be treated and convalesce at home. I can't emphasize that enough. It's only a small percentage of patients that need to go right away to live in-person care. So for those who can be treated and recuperate at home, MeMD has a system in place to get them tested at an approved facility in an orderly manner. For the very small number of patients who have a COVID-19 risk factor and who are very sick, so let's say it's an 80-year-old patient just back from an overseas trip to Japan, now has an upper respiratory infection symptoms, is short of breath, clearly needs to be transferred to live in-person care. MeMD also has a system to get those patients to that care in a timely fashion. We will help them contact EMS and get them to probably the emergency department and keep everybody informed. The last thing MeMD wants to do is transfer a patient for testing and or care where they just show up unexpectedly at a facility. We have procedures in place where these patients can be transferred in an orderly fashion and the facility who's receiving them, whether it be a testing facility or a treating facility, will know beforehand that these patients are coming. On the right-hand side, you see in the blue a summary, and our Vice President of Operations, Jess Hoster, will be going over these in more detail here later in this webinar. But we have materials for our providers as well as our patients that we can send via PDF that outline all of our policies and procedures. Again, these have been carefully crafted and created by our response team and using the materials that the CDC, Department of HHS, and state and local health departments have put out. And these are up to speed, up to date, really within the last few hours to minutes. So we are keeping on top of this. Next slide, please. So I think I've already gone through what if testing is needed. We do have those procedures in place, and we have them as we speak right now, ready to go. And we, in fact, have had a few cases where we've had to implement these procedures, and they've worked very, very well. We also educate patients who are going to be treated and convalesce at home. Again, the vast majority of even COVID-19 patients, and it's anywhere from 80 to 85 to 90 to 95% of these patients, depending on the study you look at, can convalesce at home. We give these patients and their caregivers instructions on how to do this safely at home. They're listed there. Pretty much common sense public health recommendations to keep the patient well treated, well evaluated, keep their caregivers safe, and to keep the area in which they are being treated at home as clean and as clean as possible to decrease the chance of transmitting the COVID-19 to others. Next slide, please. So one of the big questions out there is, what about testing? Why is the CDC, Department of HHS, and local and state health departments, why at this point in time are they restricting the people who can be tested? And the bottom line reason is that these agencies and laboratory test sites are currently overwhelmed with requests for testing. And so they're only testing at this time patients who have a COVID-19 risk factor as identified by the CDC. However, this is changing almost as we speak. Over the next several days to maybe a week or so, testing is going to be opened up to pretty much anybody who outside of the risk factor groups who have URI symptoms. The reason that is important, there's two reasons. Number one, the comfort of the patient of knowing, do I have COVID-19 or don't I? And also from the standpoint of the CDC, HHS, and local and state health departments being able to track, where are these cases? We pretty much already know there's community spread of COVID-19. And so we want to be able to track that as quickly as we can to see where the peak of this is, be able to track as it resolves, and be able to triage patients more efficiently. But that's 3 or 4 or 5 days away. As of right now, it's only patients who have those risk factors I outlined earlier, as outlined by the CDC, who are being tested. But this is going to change here over the next several days to a week or so. And I'll repeat one more time, MeMD has an orderly and organized system for those patients who qualify for testing to get those patients to testing, or if they're sick enough, to live in-person care, probably in the ED, but potentially in the urgent care or primary care settings. And so I think now I will turn it back over to Jess Hostert, our VP of Operations, to go through more details about the MeMD timeline, as well as the some of the things we have available for our partners, as well as our providers and our patients.
Great, thank you so much, Nick. Thank you all for joining us. We're excited to roll out and kind of introduce some of the different pieces that we put together to really have a comprehensive COVID-19 communication strategy. So while we've touched on a lot of the clinical components, really in order to make sure that everything is moving the direction that we want it to, communication really is key, which I'm sure you've all seen in your workplace as we disperse information to all of our employees. So on January 28th, we were one of the first to send out a email blast about the symptoms of COVID-19 of telemedicine providers in our industry. So we did send out an early warning about identifying those symptoms on January 28th. From there, we sent another email to our existing patients about the preventative best practices. With that, we also launched our blog post around the same time period. And during the, around March 6th, we actually launched our Stay Informed website. That's our landing page. If you haven't had a chance to take a look at that yet, I encourage you to do so. So as Nick said, he's done a fantastic job to really stay on top of what the CDC guidelines are. And that's really driving what not only the member communications, but the clinical practices that are taking place behind the scenes as well. So take a look at that website to stay informed about the latest and greatest updates from MeMD on COVID-19. As you all may have seen on March 9th, we also did a letter from our Chief Medical Officer and the Rapid Response Team to let everybody know what it is that we're doing. And then obviously today we have our coronavirus webinar to make sure that everyone is informed about and really feels comfortable with MeMD treating your patients and screening patients around COVID-19. You can go to the next slide. Perfect. So here's a couple of examples of the different marketing pieces that we've made available. We'll be sending an email blast to all of the participants today to make sure that you all are able to take advantage of these resources, whether you're a partner of ours and need to co-brand them or use the content for other purposes. And that's what MeMD is here for, to really make sure that you have all of the resources that you need to share with your employees and for your membership. And one thing I do want to point out is that MeMD's really done everything that we can for the patients that have used us in the past. So for those of you that have entrusted us with your membership population, and we've reached out to those people to let them know about the resources that they have at their disposal. But for the people that have not used MeMD, here's really, now it's your turn. That if for your first-time users that have not used MeMD, it's important that you reach out to that entire membership population and encourage them to use their MeMD benefits should they be experiencing any symptoms. We all get the enrollment packets, if you will, during open enrollment, and it's hard to remember all of the benefits that might be available. So now's a good time to remind them of their MeMD benefits so that they don't have to go stay in a crowded waiting room waiting to get care when MeMD is available at their disposal. So some interim guidance for businesses and employers. As I mentioned, we encourage you to actively encourage your sick employees to stay home. I know that many employers are having employees work from home or use remote capabilities, so now is a good time to do that if they do have. So if any employees who are well but might have a sick family member at home with COVID-19, and they should obviously notify their supervisor or notify your HR team. Make sure to separate sick employees. So if an employee is confirmed to have COVID-19, employers should inform fellow employees of the possible exposure to COVID-19 in the workplace, but maintain confidentiality. Emphasize staying at home when sick, respiratory etiquette and hand hygiene. Make sure that we are all performing routine environmental cleaning, and advise employees that before traveling to take certain steps. So check the CDC's travel or health notices, advise employees to check themselves for symptoms and acute respiratory illness before starting travel, and ensure that employees who have become sick while traveling understand that they should notify their supervisors and should promptly call a healthcare provider if advice is needed. So again, a couple of just tips and resources that are available to you in the event that you need them. And I believe that is all the content that we have available today. And I just wanted to take a look to see if we had any questions. So we did have a couple of questions about the presentation. So we will be making the presentation available to our existing partners. And for those of you that are looking at using MeMD in the future for your partnerships, then you can kind of take a look at the recording that we'll actually make available as well. I think that's all the questions that we had today. Thank you so much for your time and for joining us. Thank you for entrusting us with taking care of your members. We're honored to do so. If you have any questions, please reach out to your account management team. We'll be happy to help you.
Thank you, everybody.